Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. CAT Scan Guided Biopsy of a Spinal Lesion. Introduction. A computed axial tomography scan, or CAT scan, is a test that provides very clear pictures of structures inside the body. Doctors may recommend a CAT scan to help in diagnosing various diseases. When a suspicious lesion or tissue damage is found on a CAT scan, a biopsy can be done to try to determine the exact problem. This biopsy can also be guided by a CAT scan. If your doctor recommends a CAT scan guided biopsy of a spinal lesion, the decision whether or not to have this procedure is also yours. This patient education module will help you understand better the benefits and risks of this procedure. Test. A CAT scan uses X-ray technology and sophisticated computers to come up with the final pictures. A CAT scan machine looks like a giant donut, and the gantry is its hole. You will be asked to lie down so that the part of the body to be scanned will be placed inside the gantry of the machine. It is important to remain very still during the scan. This allows sharper pictures. The test takes from a few minutes to approximately half an hour. CAT scan technologists sit in the next room and are able to see you through a glass. They are also able to hear you at all times and are able to talk to you. If you have any questions, be sure to ask them. They will be more than glad to help you. Sometimes a dye needs to be given through the vein to help the doctor better visualize structures inside the body. The dye is relatively safe. It is an iodine-based dye. After getting the dye, the lesion becomes much clearer. X-rays are used during this procedure. The amount of radiation during this test is deemed safe. However, this amount could be dangerous for unborn children. It is therefore very important to make sure you are not pregnant before an elective radiological test. Some people have allergies to the iodine dye used in this test. Make sure to tell your doctor about your allergies and about all reactions you may have had to any sort of dye used on you in the past. In some people, the dye can cause kidney failure, especially if the patient is on glucophage, a diabetic medication. Procedure. Lesions found using a CAT scan are sometimes accessible to a needle biopsy, where some fluid or tissue from the lesion is taken and tested for problems. The aim of the procedure is to place a needle in the lesion and aspirate or draw out some fluid or tissue. A CAT scan is usually done before inserting the needle for the biopsy. The skin on top of the lesion is disinfected and numbed with numbing medicine using a needle. A longer needle is then inserted in the lesion to aspirate or draw out the tissue needed by the pathologist. This procedure is usually done while you are lightly sedated. It is therefore very important to remain very still. Further CAT scans are taken while the needle is being inserted and with the needle in the lesion. This helps the doctor make sure that the lesion is reached. It also decreases the chances of injuring surrounding structures. This tissue that the doctor extracts with the needle is sent to a pathologist who helps determine the exact cause of the lesion, if possible. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Risks and complications. This procedure is very safe. There are possible risks and complications. These are unlikely but possible. You need to know about them just in case they happen. By being informed, you may be able to help your doctor detect complications early. The risks of spinal biopsies include infection at the entry site or in the spine itself. The procedure may cause internal bleeding and nerve damage. The chance of this happening is again very low, but if you develop significant weakness or paralysis in the legs, or if you lose bowel or bladder control, you should inform your doctor. You should also inform your doctor of any medications you are taking, especially blood thinners such as Coumadin or aspirin, because these can cause you to bleed more than usual. The spinal biopsy may result in the injury of big blood vessels or intestines located in front of the spine. This may require an operation to fix the injury. More often than not, the doctors are able to come up with a diagnosis. Sometimes, however, the pathologist may not be able to find a diagnosis. If you like this video, please like and share. For similar videos, subscribe to our channel. Summary. A CAT scan guided biopsy can be helpful in diagnosing various diseases and lesions. A CAT scan is useful for pinpointing problem areas in the body and helping guide the insertion of the needle to take tissue for the biopsy. CAT scan guided spinal biopsies are very safe. The benefits far outweigh the very rare risks involved. Knowing about the complications can help you detect them early if they happen. Thank you for using Explain.